Well, we're very pleased with the performance of the BCMA targeted immunoconjugate. This is GSK-916 for short, and it's a BCMA targeting antibody linked to a toxin. And I think this approach has been particularly attractive because BCMA is such an important target in myeloma. Not only is it used for this particular moiety, but it's also, as we just discussed, an important target in CAR T therapy. So we think, in fact, BCMA, along with CD38 and other particular markers, may in fact be some of the most important to date in myeloma. In that context, this antibody is infused over about an hour, administered every 3 weeks. And in our particular trial, which was initially a phase 1 study with then an expansion cohort, we were able to demonstrate that in relapsed refractory disease, we had a response rate of 60%. Now, that's remarkable in such a heavily pretreated patient population. And if we look at the patients in whom they had received prior daratumumab, we saw a response rate of 40%. So in relapsed refractory disease, heavily pretreated, not only having had proteasome inhibition, immunomodulatory therapy, but also monoclonal antibody therapy, to see a salvage response rate of 40 to 60%, depending on the context, is quite remarkable for a single agent. So on that basis, the antibody was given breakthrough status by the FDA relatively recently, and we're looking forward to next steps going forward in terms of an approval strategy, given the strength of these results. It's important to emphasize that the results are durable. The PFS and duration of response data are very encouraging, and at the same time, the side effect profile also is manageable. Thrombocytopenia, some fatigue. There is a little corneal irritation associated with the use of the antibody, but again, with appropriate management and ophthalmological support, this has generally been actually a very manageable side effect without treatment discontinuation required. So all in all, we're very encouraged by this, recognizing it's an early phase data and an early phase study.